Okay, so now let's just look at another case note. You are an endocrinologist working at Newtown Community Hospital. Your patient is being discharged today to her local GP clinic for further case management. You quickly go to the case notes below. Using this information given in the case note, write a letter of discharge to Dr. Anna Solar, general practitioner. Newtown Community Health Center. Information are about her patient condition and your medical recommendation of her discharge. Address your letter to Dr. Solar, GP, Newtown Community Health Center, Newtown. By looking at this case notes, you can see that you're going to write a discharge letter. So the first thing you need to bring in your mind is the free discharge letter template that I just provided you. So by looking at the template, we can see that after writing the purpose statement, we need to write when the patient was admitted in the hospital stay and the nursing management should be mentioned briefly. And after that, we will write as in view of the above, it would be greatly appreciated if you could, and there we need to mention the plan. So in our discharge letter, the plan is the main thing that we need to write, and we need to write everything that is mentioned in the plan, including any drugs, any dosage that is mentioned in the plan. And we will not write any personal or past history of the patient in our discharge letter. By looking at this template, we have an idea in mind that how we will structure our letter. So now we come to the case note. We can see that in the start there is like a family background paragraph mentioned. They just put there just to confuse us. They want to know that if we are aware of the fact that we don't need to write any personal history in our discharge letter. So having the case notes in front of us, let's construct the discharge letter. So the first thing we need to write is the date. So in the case note, we can see that the patient was discharged on 15th of July 2017. So we will write this date on the discharge letter. We will write the date as 15/07/2017 because we need to write in the double digits. After that, we will skip one line and we will write Dr. Anna Solar. That is the name of the doctor we are writing, and that is mentioned exact in the writing task. After that, there is a comma and there is GP. So we need to write the full word for the GP, that is general practitioner. And there is a comma after GP, and there is Newtown Community Health Center. We will write this whole word in the next line as Newtown Community Health Center, and there is a comma after that. So that means we will write the next word in the next line, and the next word is Newtown. So we will write Newtown in the next line. So we have successfully write the date and the address. Next we need to write the dear doctor. So we will write as dear doctor. The name of the doctor is Anna Solar. So we will use the last name as dear Dr. Solar. As I already mentioned you about a rule that we need to use the last name for the adult or any patient or a doctor, but the first name for a child less than 12 years of age. So we have write as dear Dr. Solar, comma. Next we will skip one line and next we will write the regarding. So it is regarding the patient. The name of the patient is Miss Mary Bell. So we will use the last name as Miss Bell, and there will be a comma after that, and the age of the patient is 66 years. So we will write as Miss Bell, comma, 66 years of age. So we have successfully constructed the regarding patient statement as well. Now we will write the purpose statement, and to write the purpose statement we need to keep in mind the free template. So we will write here as I'm writing to update you regarding Miss Bell, comma, who was admitted on the date. The date is mentioned in the case notes as 24th of June 2017. So we will write here as I'm writing to update you regarding Miss Bell, who was admitted on 24/06/2017 and treated for a small infected left foot ulcer secondary to uncontrolled diabetes mellitus type 2. And how we know the patient was admitted for this condition, we will go through the case notes in detail. In the case note, we can see that the patient diagnosis was unstable diabetes mellitus small infected left foot ulcer. So by having some background knowledge in our mind that if a patient has uncontrolled diabetes mellitus, it can lead to the infected foot ulcer. So we have just turned this diagnosis into a statement that it was the reason the patient was admitted at the first place and is now ready to be discharged under your care. So we have write the two parts of the purpose statement, and after comma we will write for further follow-up. So here we need to remember one thing, that when we are writing a discharge letter, we will write at the end for further follow-up, not for further management, because when a specialist discharge a patient, the patient go for a follow-up to a general practitioner. So this is something we need to keep in mind. We will write like a further follow-up whenever we write a discharge letter, but when we are writing a referral letter or a transfer letter, we will write as for further assessment or for further management. So this way, by keeping in mind the template, we have successfully write the purpose statement. Now we will write the purpose expanded thing by having the template in mind, and we will start constructing it like on 20/07/2017, Miss Bell was admitted due to small infected left foot ulcers secondary to uncontrolled diabetes mellitus type 2. So we write the statement like that. After that, we write the line about the examination of the patient. We have that framework in our mind that we need to write the presenting complaint followed by the examination, all of the different things. So to write the fasting blood sugar level, blood pressure, I already gave you the format how to write these things. So by following that format, we completed this sentence. Her fasting blood sugar was in 12 plus range, blood sugar random was in 7 to 8 range, and blood pressure was at 130/80. Now we will move on and we will write as she was given lebendigamide, which would be continued, and augmentin due forte, which would be reviewed after completion of its course. And how we write this line is when we go to the case notes and we study the case notes in detail, we can see that the management and progress of the patient was she was medically hyperglycemic, agent was given like lebendigamide to continue, antibiotic therapy, augmentin due forte for review at completion. So by keeping in mind the template, we have an idea that first we need to write the statement as the patient was admitted because of what of the problem, and after that we need to write the hospital stay and the nursing management briefly. And the hospital stay and nursing management included these three things: that the patient was given lebendigamide and antibiotic therapy was given, that includes augmentin due forte. So by keeping in mind the sequence, we just converted these case notes into the statements like that. Next we will write a line about the nursing management, and we mention as here daily dressing of ulcer with saline was done and the ulcer was observed for wound margins, healing and any complication. So this line signifies the nursing management of the patient. So as you can see in this paragraph, we have successfully constructed how the patient presented in the hospital, followed by the examination, what was the blood pressure and all of the different parameters at that time. After that, we wrote a line about the initial management in the hospital that includes the medications and some antibiotics, followed by the small brief explanation of the nursing management that include the saline dressing and all of that. Next we need to write the management plan, and we will write the management plan in the next line. So when we go to the case note, we can see that in the discharge plan they say monitor medication compliance, blood sugar level, alcohol intake and diet. So we need to write like something about the management regarding all of these things. After that we need to write some encourage moderate exercise program, encourage establishment of social activities, may request metformin dosage lowering if side effects occur. So we can see that there are 4 different things we need to write in the discharge plan, and we will go on writing it as in view of the above, I would appreciate if you could watch for Miss Bell's medication compliance and blood sugar levels. Advise her to do moderate exercise, decrease her alcohol intake, take part in social activities and take a good diet. Please adjust the dosage of metformin if side effects occur. So in this small paragraph, we have successfully written down all of the discharge plan that was given. As the discharge plan is very important, we need to write everything that is mentioned in the discharge plan. So that's pretty much it. We are almost done with our letter. We just need to write the closing and our letter will be complete. So in the discharge letter, as we can see that the request and the plan go together. So in the plan statement, we have already covered the request as well, because you are giving the plan that is you are requesting at the first place. So the request is already covered in it. So we just need to write the closing, and it goes like, please do not hesitate to contact me if you have any queries. This is the universal line we have applied in the 2 letters before. So after that, yours sincerely, we know the name of the doctors. So we mention here as yours sincerely, and you will skip 2 lines, and at the end you will write doctor. And if you can see that this letter got like 420 marks out of 500, and we made a pretty good progress here. So now as you can see how easy it is to write a letter, you just need to have some templates in your mind. You need to have some rules that you need to follow, and by a little bit of practice and applying all of these techniques and strategies that I shared with you, you can easily write a letter.